Vibrant seniors, welcome. Today, we're going to delve into a topic that many might find surprising and even a little uncomfortable. We're going to discuss the reality of how, under certain circumstances, sex in your 70s and beyond could potentially carry risks. Now, I want to be very clear from the outset. This video is not intended to discourage intimacy. Instead, it's about understanding potential risk factors and promoting safer practices so that you can enjoy a healthy and fulfilling life. We're here to explore a reality that, while unexpected, is important to be aware of so that we can all enjoy the best possible health as we get older. While it's true that many seniors enjoy a healthy and active sex life, certain pre-existing conditions, combined with particular activities, can turn intimacy into a higher-risk activity, and that is what we're going to be exploring today. The key to remaining healthy and safe is knowledge and understanding, and that's what this video is designed to give you. We will be focusing on very specific risk factors and not suggesting that sex is inherently dangerous for older adults. However, these risk factors can dramatically increase the danger. This information is designed to empower you, not frighten you. This is why it is so important that you understand what we're going to talk about. Before we get started, it is imperative that I stress that this video is purely for informational purposes only and is not, under any circumstances, a substitute for medical advice. I cannot emphasize that enough. The information that we are going to discuss is intended to help you understand potential risk factors and is not to be used as a method for self-diagnosis or self-treatment. It is imperative that you always consult with a qualified medical professional, such as your doctor, to fully assess any personal risks and concerns that you may have. They can provide you with very tailored advice based on your own specific health conditions. Also, please remember that this video is absolutely not intended to discourage intimacy, but rather, it is intended to promote safe and responsible practices so that you can enjoy a fulfilling life for as long as possible. Please keep this in mind as you watch and use this information responsibly. Welcome to Vibrant Seniors, your dedicated resource for all things related to healthy and fulfilling aging. Here at Vibrant Seniors, we aim to explore all aspects of healthy aging, providing valuable information, guidance, and support to enable you to live your best life for as long as possible. If you are interested in health and well-being information for your later life, then please be sure to subscribe to our channel and also click the notification bell so that you never miss any of the valuable content that we are bringing to you. Let's begin. Let's first contextualize sex and aging before diving into the more specific issues. We want to start by acknowledging the undeniable importance of intimacy in all our lives, regardless of our age. For many older adults, sex and intimacy are and remain an incredibly important part of their overall quality of life, and this is something to be acknowledged and also to be celebrated. Intimacy is absolutely vital for emotional well-being and for maintaining a deep and meaningful connection between people. It is something that should be valued at all ages. It's also really important to address some of the common myths and assumptions about sex and aging. There are still, unfortunately, a number of stereotypes surrounding this topic, and these need to be debunked. The first and most damaging assumption is that older adults are not sexually active. This is simply not true. Many older adults maintain active and fulfilling sex lives well into their 70s, 80s, and even beyond. It is a very personal journey, and it is one that is as individual as any other aspect of our lives. Another assumption is that sex is somehow inappropriate for older adults, and again, this is not true. Sexual desire and sexual activity can be a normal and healthy part of life at all ages, and it is something that should be embraced while remaining informed about the potential risks. The ability to experience intimacy and to have sex does not simply disappear as we get older. It is often a key component of our overall well-being. It's also important to mention some of the physical changes that can occur with aging, as these changes can affect sexual function. For example, men may experience erectile dysfunction, while women may experience vaginal dryness or other changes. These kinds of issues are completely natural, and they are also very manageable. It is important to be aware of them so that you can seek help and support as needed. It's also important to remember that these changes don't necessarily mean the end of your sex life. They just mean that you may need to adjust your approach and explore alternative ways to find pleasure and intimacy. We just want to acknowledge these changes as a very natural part of the aging process. It is all very manageable. With that being said, and to reiterate, this video will be focusing specifically on certain risks that could potentially be associated with sex in your 70s and beyond. It is not suggesting that all sex at this age is inherently dangerous. We are here today to discuss very specific risk factors so that you are well informed and you can take the appropriate action. I want to set a tone of respect here. Sexuality is a very personal choice, and the decisions that you make should be made with both your own and your partner's comfort in mind. However, safety is of paramount importance, and it is something that we should all be aware of, and we should all be mindful of the risks. As we move forward, I want to encourage a mindset of open communication, both with your partner and with your doctor. This is the key to a long, healthy, and enjoyable life. Let's move on now to our first risk factor: pre-existing heart conditions. There is an important connection between your heart health and sexual activity. The fact is, sexual activity, like other forms of physical exercise, can increase your heart rate and your blood pressure. This is absolutely normal, however. If you already have a pre-existing heart condition, this added stress can, in certain circumstances, lead to serious complications. This is absolutely something that needs to be considered. There are some specific heart conditions that can pose a higher risk, and these include coronary artery disease, heart failure, uncontrolled high blood pressure, unstable angina, or a recent heart attack. If you have any of these pre-existing conditions, it is absolutely imperative that you talk to your doctor to assess the risk factors involved with sexual activity. If you've been diagnosed with any of these conditions, it's important to be extra careful and to understand the potential dangers. The reason why these conditions are a cause for concern is that the added stress on the cardiovascular system during sex can potentially lead to very dangerous complications. This added stress may cause your heart to work harder than it should, and this can increase the risk of chest pain, a heart attack, an irregular heartbeat, or other cardiac events. This is something that needs to be taken very seriously. In some cases, the added strain on your heart may even trigger a potentially life-threatening heart event. It is absolutely vital to understand that if you have a pre-existing heart condition, you are more vulnerable to these kinds of problems. It is also extremely important to be aware of some of the potential symptoms of heart-related issues during sex. These can include things such as chest pain, which may feel like tightness, pressure, or squeezing, or an unusual shortness of breath that you wouldn't normally experience, or palpitations, where you might feel like your heart is fluttering or racing. You might also feel dizzy or lightheaded, or even faint during or after sexual activity. If you experience any of these symptoms, you should immediately stop what you're doing and seek immediate medical attention. This is a serious issue, and you should always put your health and safety first. If you have any kind of heart condition, it is essential that you discuss sex with your doctor and that you follow their medical advice. They are the best people to give you personalized advice about how to stay safe while still enjoying intimacy. They can also carry out a thorough evaluation of your overall health and then provide you with guidance and recommendations that are specifically tailored to your own individual circumstances. They might perform tests to understand the full state of your health and then advise you about how you can manage it. It is imperative that you are fully open and transparent with them so that they can provide you with the most appropriate advice. It's also important to mention that there is the potential for some medications to interact with sexual activity. Certain medications for heart conditions, for example, can impact your blood pressure and your heart rate and these can then increase the risk of complications during sexual activity. These are things that need to be understood. You must be honest with your doctor about all of the medications that you're taking so that they can identify any potential risks. This includes any over-the-counter medications, as well as any herbal remedies that you might be using. This also includes the medications that you use before, during, and after sexual activity. While these potential risks do sound very serious, please know that it's not all bad news. With the appropriate planning and preparation, many people with heart conditions can safely engage in sexual activity. This often involves some lifestyle changes, careful medication management, and always listening to the advice of your doctor. It is also important to be aware of your limitations, to communicate honestly with your partner, and to be aware of any potential warning signs so that you can act on them quickly. Many people with heart conditions enjoy a very healthy sex life. Now, let's move on to our second risk factor, which involves the issues that can arise due to specific medications. While we just touched on heart medications, it is important to also understand that certain medications, beyond those for heart conditions, can create risks when you're engaged in sexual activity. It is imperative that you understand this issue and take the appropriate measures. We are particularly concerned about the medications that can cause low blood pressure or dizziness, and there are quite a few of them. These can include certain medications for high blood pressure, such as diuretics, as well as certain types of antidepressants, and also some types of anxiety medication. These types of medications can all impact your blood pressure, and they can also make you feel dizzy, and these side effects can create additional risks during sexual activity. The reason for this is that the side effects of these types of medications can then lead to issues such as dizziness, fainting, and falls during or immediately after sexual activity. This, of course, is a significant concern. It is also important to remember that these symptoms may be exacerbated by any physical exertion. You must therefore be very mindful of any side effects that you are experiencing. Your safety must be the top priority. It is important that you understand that the risk of falling can be a particular concern in the context of intimacy, as it may be more difficult to move in the usual ways, and people may often find themselves in unusual positions during intimacy. If you are experiencing mobility issues, then you should create a safe environment for any sexual activity, and this will minimize the risk of falls and injuries. You should also be very aware of your limitations and communicate clearly with your partner about what is comfortable for you. This communication can go a long way in preventing injury and protecting your safety. In addition to the medications that can cause low blood pressure or dizziness, there are some other medications that can also affect your sexual function. These can include medications that may affect the ability to maintain an erection or your ability to experience an orgasm. These issues can lead to you straining or overexerting yourself during intimacy, and this, in turn, can then lead to other issues or potential injuries. These, again, are important factors to be aware of. If you are concerned about any of this, then it is absolutely essential that you review all of your medications with your doctor. This is something that you must do. You should always be completely transparent about all of the medications that you are taking, including any over-the-counter medications, herbal remedies, or supplements. It's important to fully understand if any of your medications pose a risk when you are engaged in sexual activity or other forms of physical activity. This transparency will allow your doctor to assess your particular situation and offer the best advice for you. You should also consult with a pharmacist who is also able to advise you about any potential medication interactions. Remember that it's not about avoiding sex, it's about being proactive and about engaging in open communication with your medical professionals. Your health and safety are paramount, and this is why it is so important to have regular conversations with your doctor about all of the medications that you are using and the effects that they might be having on you. Knowledge is the key here, and the more informed that you are, the better. Let's discuss our third risk factor now, which is overexertion or engaging in unfamiliar activities. Physical strain is a really important factor and something that needs to be considered. Vigorous or unfamiliar sexual activities can place stress on your body, especially for older adults who may have decreased physical conditioning. As we get older, our physical abilities can gradually decrease, so it is important that you are aware of this and that you are always careful to avoid any overexertion. There are some very specific situations that might be considered risky, and this includes engaging in positions that are particularly physically challenging or that place undue stress on your joints, your lower back, or your neck. These kinds of positions can lead to sprains or strains or other types of injuries. Another issue is engaging in sexual activities of excessive duration. Overdoing it can lead to exhaustion and other complications. Combining sex with other strenuous activities, such as alcohol consumption or recreational drug use, can also increase the risks involved in sexual activity, as these substances can often affect your coordination, judgment, and your ability to respond to situations. Another issue to consider is quickly jumping into a sexual activity that is more physical than normal. It's important to gradually build up to it and not to overdo it. These are all things that need to be thought about. The reason why these situations increase the risk is that they can place excessive strain on the muscles, ligaments, and tendons, particularly for people who have pre-existing conditions, such as arthritis or other mobility issues. This can lead to muscle strains, sprains, or even more serious complications. It's important to be very aware of the physical limitations of your body and not to try to overdo things. It's really important to be mindful of how your body is feeling and not to push it too hard. It is absolutely essential to be mindful of your physical limitations. You should always communicate openly with your partner about what your comfort levels are and be prepared to make adjustments as needed. If you are feeling any pain, discomfort, or exhaustion, then you should stop the activity and rest. You should never feel pressured to do anything that you're not comfortable doing. If you have any existing joint or muscle problems, you should be particularly careful about the positions that you try and avoid any positions that place unnecessary stress on your body. This will help you to avoid any potential injuries. It's also important to gradually increase any activity as you build up your strength. You should always start slowly and gradually increase the pace and intensity of the activity as needed, while communicating with your partner regarding the pacing and the intensity of the intimacy. It is also absolutely vital to always listen to your body and stop immediately if you feel any pain or discomfort. You should never push yourself too hard. Your comfort and enjoyment are always the most important aspects of sexual intimacy. Remember that comfort and enjoyment are absolutely essential. Intimacy should be something enjoyable, and it shouldn't feel like an endurance test. There are many ways to be intimate that don't involve any strenuous activity, so you can consider trying some less strenuous positions or activities. You do not need to have a marathon to experience intimacy. The goal is to have a mutually enjoyable experience where both partners feel safe and comfortable. Let's move on now to risk factor number 4, which is the issue of undiagnosed health conditions. Many people may have underlying health problems and they don't even know it. These undiagnosed conditions could potentially increase the risks associated with sexual activity. That is why it is so important to make sure you get regular checkups. This is something to be very aware of. There are some specific conditions that often go undiagnosed, particularly in older adults, and these include mild or undiagnosed heart conditions, such as high blood pressure or circulation problems. You may be completely unaware that you even have these problems, so it's important that you get checked out by a medical professional. It is also important to be aware that conditions such as sleep apnea or other breathing problems can also go undiagnosed for a long time, and they can significantly increase the risks associated with any form of physical exertion. There can also be undiagnosed neurological problems that might impact your coordination or your response times. This is also something that can increase the risks associated with sexual activity. The problem with undiagnosed conditions is that you may be completely unaware that you are vulnerable. These conditions can increase the risks associated with sexual activity, and they can potentially lead to serious complications. For example, someone with an undiagnosed heart condition could be more vulnerable to having a heart attack during sex, while somebody with an undiagnosed blood pressure issue might be more susceptible to stroke or other cardiovascular problems. Similarly, someone with any undiagnosed breathing problems might struggle with their breathing or experience dizziness or faint during sexual activity. These things need to be understood. That's why regular checkups are absolutely essential for your overall health. It's very important to have regular physical examinations with your doctor so that you can stay informed about your health. You should always be completely honest with your doctor about all of the symptoms that you're experiencing, no matter how insignificant they might seem. They are often a vital clue in the process of diagnosis. Early detection of health conditions can prevent serious complications, not just during sexual activities, but also in your everyday life. The value of proactive health management should never be underestimated. It's always better to address an issue sooner rather than later, as early intervention can make a huge difference to your health outcome. It is also important to remember that even something like mild sleep apnea can increase the risk. Sleep apnea can cause you to have interruptions in your breathing during sleep, and this can lead to a decrease in oxygen levels in your blood, as well as fluctuations in your blood pressure. And these issues can then increase your risk of cardiovascular events during any kind of physical activity, including sexual activity. Therefore, if you're experiencing sleep problems, such as snoring or feeling unusually tired during the daytime, or if you have been observed to gasp for breath when you are sleeping, then it is vitally important that you are assessed by a medical professional to determine if there is any underlying sleep condition that needs to be treated. Please be proactive about your health and always seek professional medical advice if there is anything that concerns you. Moving on now to our fifth risk factor, dehydration and environmental factors. It's incredibly important that you understand how these two factors can negatively impact your health during sexual activity. Dehydration can often lead to low blood pressure, dizziness, and also fatigue, and these symptoms can significantly increase the risk of fainting or other complications during or after sex. This is often overlooked, and it is something that is really important to be aware of. Dehydration can severely compromise your health, and that's why staying properly hydrated is so incredibly important. You should always make sure to drink plenty of water throughout the day, and it is especially important to stay hydrated before and after any form of physical activity, including sexual activity. Your hydration levels are something that you should absolutely be mindful of, particularly if you are living in a hotter climate. If you are feeling particularly thirsty, then you are already dehydrated, and this is something that you should avoid. You should be drinking fluids regularly, and before you feel thirsty. It is also important to consider the impact of environmental factors and how they may affect your body during sexual activity. The main issue to consider is engaging in sex in excessively hot or cold environments. Extreme temperatures can negatively impact the body's ability to cope with the physical stress that is associated with sexual activity, and it is very important to understand how this may affect you. If you're engaging in sexual activity in an extremely hot environment, for example, this may lead to dehydration and low blood pressure, and you might find yourself feeling dizzy or faint. Also, if you engage in sexual activity in an extremely cold environment, then this may lead to a constriction of your blood vessels, which will then make it more difficult for your heart to pump blood around your body. This could then lead to other complications. It's important to be mindful of all the environmental factors that could potentially impact your body. That's why creating a safe and comfortable environment for sexual activity is so vital. This can include making sure that the ambient temperature is comfortable, and neither too hot nor too cold. It is also important to consider if the location is comfortable and familiar. Creating a safe and familiar location is an important aspect of being able to relax and enjoy yourself. These seemingly small steps can have a very significant impact on the overall experience. Remember that you should always stay mindful of your environment, as it is absolutely essential in providing a safe and fulfilling experience. You need to consider all of the factors that are surrounding you so that you can make the best choices for your own health and well-being. This will enable you to have the most comfortable and positive experience. Now, let's transition to a more positive topic by looking at safer sex practices for older adults. Up until now, we've talked about the risks, but now we're going to talk about positive ways to ensure safety and enjoyment so you can feel empowered and secure in your choices. This is all about being proactive. The first and most important thing that you should always do is to consult with your doctor. Your doctor is there to assess your personal risks and to provide you with the necessary advice and guidance on managing any underlying conditions as well as any medications you may be using. They are the best person to advise you on your own personal health journey. You must also always make sure that you communicate effectively with your partner. Discuss your needs, your comfort levels, and also any potential limitations that you may both be experiencing. Open and honest communication is absolutely vital for both your safety and your enjoyment. You must also always be mindful of your own physical limitations. Avoid any strenuous positions or activities that could potentially cause you injury. And of course, always stay properly hydrated by drinking plenty of water throughout the day to help you to maintain your blood pressure and also to help to prevent dizziness. It's also very important to create a safe and comfortable environment. This will minimize the risk of falls or other accidents. You should also be sure to listen carefully to your body and not push yourself too hard, and always seek immediate medical attention if any symptoms occur. It's important that you never ignore any symptoms that may be causing concern. If something doesn't feel right, then you should stop immediately. It's also essential to remember that sex is a positive and enjoyable part of life. It is incredibly important for both your physical and emotional well-being, and it should always be a safe and a pleasurable experience. You do not have to push yourself too hard, and you should always be enjoying the experience. With these steps, most people can enjoy a healthy and fulfilling sex life well into their older years. It's about being sensible, being prepared, and also being proactive. And now, let's explore some of the questions that you might have regarding sex and aging in our Q&A session. Many people have questions about this, so we'll address a few of the common ones. The first question that many people ask is this: is it okay to use medications for erectile dysfunction? Many men may experience difficulties maintaining an erection as they get older, but the use of medication, such as Viagra or Cialis, can make this easier to manage. However, it's imperative that you talk to your doctor, as some of these medications could interact negatively with other medications that you might be taking, particularly if you have any pre-existing heart conditions. You must always seek medical advice before taking any kind of medication. Another common question that we hear is, are certain positions safer than others? This is absolutely true. Certain positions can put more strain on your body than others. It is best to choose positions that are comfortable for both partners and to avoid anything that could potentially place undue pressure on your heart or on your joints. And you should also be aware of any mobility issues that you may have. You should also choose positions that you are able to maintain for as long as you wish, without feeling overexerted. It is important to try out different options to find out what feels best for you and your partner. Finally, many people want to know, how often is too often for older adults? There is no one-size-fits-all answer to this, as it very much depends on your overall health and your personal preferences. The key is that you should always listen to your body and do not push yourself too hard. If you are feeling unwell or very tired, then you should avoid sexual activity. It is absolutely vital that you do not overexert yourself. You should be guided by how you are feeling. If you are ever concerned about frequency, then please seek medical advice. Please remember that these are just a few of the potential issues you may experience, and it's vital to seek out medical advice that is tailored specifically to your own individual circumstances and needs. Always be completely transparent with your doctor and open about all of the medications that you are taking or any symptoms that you are experiencing. The information we've provided today is intended to give you a starting point for a more detailed conversation with your doctor about the choices that are right for you. It's also important to remember that there are individual differences that should always be considered. There is no one-size-fits-all answer to these questions, and each person needs to listen to their own body and also follow the medical advice that has been provided by their doctor. What works for one person may not work for another, so it is vital that you understand your own individual needs and make your own choices accordingly. It's also very important to remember that your partner also has individual needs, and it's important that you respect each other and always communicate openly with each other. If you feel that you would like further support, then you should always seek out the relevant resources. There are numerous websites, helplines, and organizations that can offer additional support and information about sex and aging, and these can offer very detailed information that is specific to your situation. These resources are invaluable. If you would like help in finding these resources, please leave a comment below and we can give you further guidance. It's important to remember that you're not alone and there is a lot of support available. It's also important to remember that you should never feel embarrassed or uncomfortable about discussing sex. Intimacy is a natural and healthy part of life. You should always feel comfortable discussing your concerns with a doctor or a trusted friend or family member. And now, let's move on to our call to action. It is incredibly important to take action on the information that you've been provided today, so here are some steps that you should follow. Firstly, you should talk to your doctor and discuss any concerns that you may have about the potential risks associated with sexual activity, based on any medical conditions that you may have or any medications that you are using. You must always be completely honest with them, as they need to understand all the facts in order to provide you with the best possible advice and the most appropriate guidance. You should also discuss all of your concerns with your partner so that you can both feel comfortable and secure in your decisions. It is essential that you have a partner that is fully informed and that you are both comfortable with the levels of activity that you both choose. It's also very important that you always make sure that you are taking your medications precisely as they have been prescribed, and that you are fully aware of any potential side effects. It is also vitally important that you share this video with your friends or your family members who might find it helpful. The more people who are aware of these issues, the better, as knowledge is the key to staying healthy and secure. The more people who are informed about these topics, the greater the overall level of safety will be, and the more people will be empowered to take the correct measures to ensure their well-being. Please share this information responsibly. Remember that our main goal today is to help you to take proactive control of your health and to empower you to take the appropriate steps. We are not here to deter you from intimacy or to frighten you in any way. Our purpose is to empower you to stay as safe as possible. We believe that it is essential that you are aware of all of the potential issues so that you can make the right choices for you and your individual needs. It is absolutely imperative that you seek early diagnosis and also seek early consultation whenever you have a concern. Finally, let's move on to our closing message. We would like to thank you very much for watching and also for engaging with such a crucial yet sensitive topic. It is really important that we discuss these issues openly so that people can stay safe and healthy for as long as possible. We would like to remind you that here at Vibrant Seniors, our mission is to promote healthy aging and to provide you with the best information so that you can lead your best lives for as long as possible. We are dedicated to empowering you and to helping you make well-informed choices. It is incredibly important that you prioritize your health and well-being at every stage of your life. If you have found this video useful, then please do not forget to subscribe to our channel and also click the notification bell so that you never miss any of our valuable content. Please share this video with anybody who might find it helpful, and please feel free to add to the discussion in the comments below. Your input is incredibly valuable and helps us to ensure that we're bringing you content that meets your needs and is of the highest quality. Remember that you should always prioritize your health and also enjoy all aspects of life, including intimacy, while ensuring that you have all the information that you need to stay safe. Stay informed, stay safe, and enjoy your journey through life. Thank you, and we look forward to seeing you all again next time.